欢迎来到 PCE Club 5月的线上聚会，我是 PCE 的义工小松球。现在时间已经到了，那我们先占用一点点时间，介绍一下我们今天月会的形式以及 PCE Club。是刚好也等待一下正在赶来的伙伴们。同时呢，我也想邀请已经上线的伙伴们，如果方便的话，可以尽量打开你们的摄像头，这样让我们即使隔着时空，也能够看见彼此，有更好的连接和互动。让我们一起沉浸在这个当下，享受今天晚上的这次约会。这次约会的预计时长是2个小时，前1个半小时会由义工景山和 Alice 对我们今天请来的嘉宾资深的精神科医生王莹医生进行访谈，最后的半个小时会开放给现场的观众进行问答。整个讲座会进行录像，但是考虑到保护提问者的个人隐私，所以 Q&A 环节我们不会进行录像。在提问环节还欢迎大家踊跃发言，贡献您的宝贵问题。那我也想借这个机会向第一次接触 PCE 的新伙伴们介绍一下 PCE Club。PCE Club 的中文名叫做父母子女教育俱乐部，是成立于2003年的由新泽西的5个华人家庭发起的非营利、非宗教、非政治的教育组织，致力于为华人家庭在育儿道路上提供一个抱团前行、互帮互助、少走弯路的讨论平台。我们注重情商教育，而不是成绩，关注孩子的心理健康，注重理解孩子，用同理心来增进亲子沟通。18年来一直坚持学习和宣传情商育儿，并且践行育儿育己、成长及成功的理念。我们的目前的主要活动为每个月第2个周六的月会，内容会围绕着情商育儿、自我成长和身份认同，以及青少年实话实说这4大板块展开。在每年的10月份会进行大型的教育研讨会，聘请教育界的专家学者来亲临指导。如果想了解更多我们的活动信息，以及收看往期的精彩回放，欢迎移步我们的网站、YouTube 频道以及我们的公众号。如果你也想加入我们这个大家庭，欢迎扫码我们的微信助手。这些是我们近期举行过的活动，以及我们即将开始的课程。最后我想占用一点点时间给我们明天即将开始的静心课打一个小广告，最后一天的报名机会了。如果你也跟我一样经常感觉到好像学了很多的育儿知识，但是面对冲突或者遇到挑战的时候就是使不出来这些学过的本事的话，那不妨来尝试一下静心课，帮你找回你的内在稳定，有更大的心理空间可以支持帮助到孩子。那下面我把宝贵的时间交给金山。
那我来简短介绍一下王莹医生。王莹医生算是我的老朋友了，或者说其实我是他的粉丝。他来 PCE 讲过几次，但是呢，我们之前比较遗憾的就是说每一次我总觉得没给他足够的时间。就是他王医师的背景是就是精神科医生嘛，他是在耶鲁大学的医学院就是拿的那个就是 MD， 就是医学的那个学位，然后后来是 residence 是在MGH 就是 Mass General Hospital 和那个是全国排名对全国排名第1的，应该是非常有名的一个医院。然后他是哈佛医学院的叫做 affiliated 哈，然后他在那个哈佛医学院residence 的时候，我看到他是好像还不是一般的 resident， 是那种 lead 是吧
？Chief Resident，
Chief
就是总住院吧，可能是中文翻成这样子。
总住院医，然后也在那个 Harvard Medical School 教课是吧？
对，
然后其实他以前来的时候分享过一些别的方面的，比如说大学毕业的时候其实是去华尔街工作了，后来那个希望就是活出一个更 就是更符合自己内心那种意义感的那种找那种方向，然后转而去去这个医学院学这个精神科，就是希望能够在我看来，他就是想要去看到很多人都在受到各种各样的挑战、冲击啊、suffer，就是受到这些折磨，想要去帮助别人，想要去就是这个修补世界吧。反正在我看来，就是王医生其实很符合我脑海中想象的那种，就是说好的教育出来一个人他是个什么样子，那种我的那种想象是那种知识面也很宽广，然后对很多问题都有比较深的认识吧，然后也有很多这个 compassion， 就是那种爱心、同情心，然后跟人打交道的界面也很友好，而且非常聪明，跟他互动就是你问他问题，他马上回答，就是脑子很快。然后
这下子我压力太大了。
没有这些词，你当然你是不好意思自己说自己的，这个我说你吧，就是可以比较就是说不带谦虚的把这个我也不带夸张的，我是真的是这么想的，我在这么说。所以我们今天非常有幸非常高兴能把梅医生请过来，就给他比较多的时间，让他充分的去给我们多讲一些东西。然后中间可能另外一位一共 Alex 和我都可能会中间穿插一下来就是提个问题啊，或者是稍微对话一下。
好，谢谢景深，谢谢这个 introduction， 这个让我真的是非常的感动，也很激动。这样一感动一激动，我中文就表达能力就有一点问题。我非常的荣幸今天能有这个机会，能有这个平台来跟大家一起讨论，就是心理健康方面的问题。作为一个母亲，我觉得从 PCE 各种活动中，我也受益匪浅。我第一次碰见景山，好像是在那个 Chinese school。那个还是好几年前，你在那边发散传单，然后那个时候我带我孩子去上课，然后当时一下子谈话当中就发现，其实你对心理健康是一个爱好者，然后慢慢从那之后我接触到这个 PCE 各方面的活动，你开始说就是我从 Wall Street 转到心理学是好像说是修补世界，我觉得更重要的是修补自己，找到就是真正适合自己的这个行业，然后同时能做一些 contribution。所以说现在我能有这个机会来和大家分享我的专业知识，能和大家一起学习，一起成长，真的对我来说是特别有意义的一件事情。所以我要非常的感谢 PCE， 感谢这些 volunteers， 感谢景山和 Alice 这一次在开这会之前跟我一起 go through some of my slides， 给我一些 feedback， 也感谢所有来参加这个会议的朋友们。我希望我们一起来学习，一起来成长。好，那现在是不是就是我要 share 我的 slides 了，还是
你开始
了吗 ？OK， 好，那我来分享我的屏幕哈。OK，give me one second。Share portion of the screen。大家现在能看见吗？看不见是吗？
我没看见。
现在看不见。
哎，这是怎么回事情呢 ？I'm sorry。
那我说几句。王莹医生他是应该差不多11岁左右来到美国的吧，所以他的中文其实讲的是很好的。不过他的就是他的医学方面的术语，什么心理学方面的那些术语都是用英文学的，他对这一块的中文就不太熟悉，所以有些东西他可能会用英文。
现在看到了。
现在可以看见了是吗 ？OK，good，OK， 好，OK， so let me get started。OK， 我们今天呢，我 cover 的内容稍微有一点广，一方面是因为我被布置的任务是给大家做一些心理疾病和治疗途径的科普，让大家对这个专业心理治疗有一个比较 organic 的认识，以及包括一些就医的 logistics。另外一方面呢，我也想给大家一些具体的 self-help skills， 而且比较着重的讲 CBT 和 DBT 这两个是景山和 Alice 都比较希望听到的，所以呢covering a lot, it's a little bit ambitious. I will do my best. 如果哪一些 topic 大家比较感兴趣，希望多讲一点的，大家可以maybe type in the comment box. We don't have to cover everything. 如果有东西没有来得及讲也不要紧，但是我就要想比较就是灵活的，大家什么感兴趣的我就多讲一点 ，OK？ and also please be patient. 一开始如果对你来说太基础了，太 basic 了 ，there's going to be good stuff later on. So just a quick outline. We'll start with what is mental illness and how do I know if my struggles are pathological? How do I talk to my family members and friends who need help? What kind of treatment settings exist and how do I access them? And then when it comes to treatment, I will talk to you a little bit about medications as well as therapy, focusing on CBT and DBT. Okay, so what is mental illness? 精神疾病它其实就是影响一个人的思维、情绪或者行动的一种疾病。它不是性格缺陷，也不是 weakness. It's not something that you can just pass with time or get snapped out of it with willpower. There's a variety of different types of psychiatric illnesses. 像抑郁症啊、焦虑症呀，像双向情绪障碍等等。我常见的到我诊所来常见的可能就是属于 depression, anxiety, OCD, bipolar, psychosis, PTSD. As you can see, a huge range. 并不是说我有了精神病，我有了精神病就代表我 crazy. No, there's a huge range of different disorders. Specific causes for psychiatric or mental health issues are not really clear. But what we do know is 就是各种各样的因素它会增加精神疾病的风险，包括像家族史、general physical health condition, significant life events such as a past experience of trauma, loss, death of a loved one. All of these can potentially be risk factors. One of the most common reasons for people to come see me is depression. 抑郁症是非常非常的 common and very treatable. Yet, 35% of adults who need treatment for depression do not receive it. So, depression, what does it look like? 它到底是个什么样子呢？情绪低落。
我打断一下，就刚才你这个里面，有两点，一个是说，因为你是精神科医生，所以来看你的，就是看相对来说会要是重一些的，因为有心理咨询和心理治疗，
对，
就是那个 talk therapy， 就是只是谈话的那种，可能有些就是比这个要轻一些的，可能有很多是没有到这些双向
对，可能他的起步是 a therapist， 然后呢，可能当 therapist 觉得他这个比较严重的时候，可能会 refer to a psychiatrist， 就是到我这里来，是这样子的。但是也不完全这样子，也有就是 relatively mild symptom， 就是直接到 psychiatrist 这里来都有。但是你说的是正确的，很多人大部分人他如果是刚刚开始接触这个 mental health services， 可能他的起步是 a therapist, like a psychologist, a social worker, licensed counselor 之类的。对。
然后上一张 slides 里边有一点我比较印象深刻的是，就是说35%，还有说25%的是那个人是处于 depression 的状态，是吧？
就是50%的 Americans at some point in their life will meet diagnosis criteria for a mental health issue, mental illness.
就是医生当中是50%，然后但是在任何一个时刻，我记得看到的说25%。
对，
那个数目吓了我一跳。
Yes, it's very very prevalent.
就1/4的人是有这个抑郁的。对。那你继续。
王医生，这个所以 pandemic 期间肯定有很多人焦虑和 depression， 有 depression 吧？ 这个
There was
数
a
字可
huge
能
uptick. Yes. So specifically, 它现在具体是在哪一个数字 I don't know because this has changed because of now pandemics in a different phase from it was in 2020 and 2021. And, you know, the surveys that have gone out, it depends on whether you're looking at symptoms of depression or actual diagnosis of depression. But what we do know is that there was a huge uptick in depression and anxiety and a huge uptick in suicidal ideation and substance abuse during that time.
Okay, thank you.
Yeah, good point, good point. So what does depression look like? Okay, so the symptoms of depression, I think 我们大家其实都多多少少有经历过的，像情绪低落low mood, change in appetite, 食欲改变睡眠的问题 agitation, 情绪激动 fatigue, difficulty concentrating, etc. 这些症状其实我们大家都不陌生，但并不代表你有过这个就一定 meet clinical criteria. 下面我们会更具体讲一讲。Anxiety is another very common reason for people to come to me. So what does generalized anxiety look like? These symptoms look familiar to us, right? 过分忧虑暴躁不安疲劳肌肉紧张易怒等等。那怎么样子来区别我们到底是经历的就是比较normal day-to-day kind of depression and anxiety or a pathological issue? And how do I know when I must seek help? Let's look a little bit more closer at that. 我们先看一看 normal sadness versus depression, okay? The main things we want to focus on when we differentiate between what is normal sadness versus clinical depression are duration, 它持续的时间 severity, 严重程度 and whether or not there's a specific trigger, 就是有没有具体的触发因素 With normal sadness, we might feel down for a day or two, or even more, if there's like a deep loss or some big unexpected event. But generally, we're still able to enjoy simple things and things that we normally do. 比方说，你平时比较喜欢听音乐，看什么电视节目，和大家在一起 socialize， 这些事情你基本上应该是还可以正常的去进行的。But with clinical depression, our sadness and helplessness is so overwhelming that often we don't find joy in these things that we normally enjoy. We don't find the motivation that we normally have. And our sadness and helplessness kind of encompasses everything, not a specific trigger. Sometimes there can be a specific event or trigger, but often we just feel down and sad and helpless generally about everything. All right, so clinical depression generally lasts 2 weeks or more. Usually it's much longer than that. And it interferes with our daily functioning. 它就是比较明显的、严重的影响我们的日常生活。而这种情绪它并不一定有这个 identifiable cause 或 trigger. And then the differentiation between normal anxiety and anxiety disorder follows a similar pattern. 就是正常的这个 anxiety, 它是有一个具体的 trigger. There's a starting point and an end point. Whereas anxiety and anxiety disorder may be triggered, but often it comes out of nowhere. And its severity, 它的严重性 can be very, very intense, 很强烈。然后呢，可能就是 out of proportion with the situation, 就是不成比例的。可能是一个很小的事情，但是你可能会非常非常的紧张，非常的惶恐。那 normal anxiety 正常的这个焦虑 sometimes can be helpful. 比方说你现在可能有点紧张，比方说我有一点点紧张，但是这种紧张情绪它不妨碍我来说话它 even it can motivate us to perform a little bit better. But anxiety from anxiety disorder typically is not helpful. It's dysfunctional and it interferes with our ability to function. 所以 again 就是我们看它的严重性，它的持续多久，和就是有没有这样具体的一个 trigger. So when should you seek professional help? You know, there are different types of professional help. If we're thinking about inpatient, 就是住院治疗，那它有一个就是很具体的 criteria， 比方说有就是人身安全的问题，或者是你没有办法自己来照顾自己，那到这个地步的时候，那要去住院。但是如果说你是在考虑就是 outpatient， 像门诊去看一下心理咨询师之类的， there's really no lowest threshold when it comes to outpatient mental health care. If you've been thinking about it for a while, if you've been wondering about it for a while, you probably should just go. 不会说是你去看了这个咨询师，然后咨询说你小题大做，你没有必要 that shouldn't happen. You should be taken seriously. So if you've been thinking about it, you should check it out. But let me list the conditions for when you really should or when you must seek professional help. 当你有以下症状的时候，那就说你这个时候，或者说你家人这个时候就必须的去看 professional help 了。当你有自杀念头，当你有幻觉，当你有妄想，当你有这个化学依赖，包括酒精依赖或者是安眠药依赖，当你有反复的惊恐，像 panic attacks, repeated panic attacks， 当你的这些症状导致你没有办法进行正常生活，没有办法维持你的工作、你的学业，或者是没有办法维持这个 interpersonal relationship， 或者当你的症状导致各方面的 health conditions， 比方说就是持续的疲劳、持续的失眠、持续的头痛、胸痛等等。当你有这些症状，当他们持续不休的时候，那这个时候你就是really need to get professional help. Then some people may say, 我的 anxiety, it causes me to withdraw. 有的时候我是睡眠不太好，但是这个我这一辈子就这样子了，我也没怎么的，对不对？而且我父母亲他们这一辈子也就这么过来的，这个也没什么大不了的，对吧？Don't we all live lives of quiet desperation anyway? So what I think about this is, let's think about who else is affected by our quiet desperation. Maybe ask your family, ask your friends. I'm not saying this to make people feel guilty or shameful, but I think it's important for us to realize that mental health problems, they don't just affect us, the individual, but also people who are in our lives. We can't really fully engage with other people. We can't really give to others when we're so depleted ourselves. And also, because we're in the parenting club here, if we want our children to take good care of themselves, we really need to model good self-care for them. I can tell you, in my clinical practice, so many of my patients tell me that they can't shake the memories of their parents' mental health struggles as they're growing up, and it really, really affected them. So again, I'm not saying this to shame or guilt anybody who hasn't gone to, get professional help, but I want to provide the perspective that this is an opportunity for you to advocate for yourself and an opportunity for you to help your children see that mental health issues are okay to have, they're okay to talk about, and it's okay to go and get help for them. And the other thing is, remember, for most mental health issues, the earlier you intervene, the better the outcome. If you wait until things are really, really bad, it gets harder to treat, and the treatment course may actually have to be stretched out a lot longer. So just because you don't have to, just because nobody is forcing you to, doesn't mean that you shouldn't. Think about what you have to gain and what you have to lose if you postpone care. In Chinese culture, as in many other ancient cultures, we have a tendency, I think, to not just accept suffering as a normal part of life, but even to glorify it. I hope I'm not offending anybody or cultural anthropologists when I say this, but for me, I was in China until I was 11, and I remember growing up learning 吃得苦中苦，方为人上人. A lot of Chinese students have endured a great deal of pressure in their academic life. So that feeling of stress and anxiety and that feeling of inadequacy, that's just part of life. It's so familiar. It's been normalized. 一个成语我就是小时候学到现在，我每次想到这个，我都觉得心里边不是滋味，就是悬梁刺股。就是我小时候学这个成语倒没有觉得怎么的，觉得很了不起，应该这样子的。但是现在作为一个心理医生 when I look at this, I have a different perspective. This is kind of self-abusive behavior. It's self-injurious, right? But when I first learned it, it was something to be looked up. It was accepted and even praised. So I think our perspective sometimes of what is okay and what is not okay, what's unnecessary suffering, may be a little bit off because of our culture. We may not as readily perform acts of self-care and to have compassion for ourselves. And we may fail to see that the pain we experience goes beyond normal pain of human existence and actually may be pathological. So when you're struggling with, is this enough suffering or not? Let's be honest and let's not dismiss our suffering. Okay, so perhaps instead of asking, should I get professional help? We should ask, why not? Why not get professional help? What's getting in the way? 为什么不呢? So from this perspective, actually, I think maybe it's helpful for me to kind of turn the question over to you guys. Maybe maybe our moderators, Alice, I think you could maybe share some 从你的这个观察，你的周围，你的朋友啊什么的。为什么有些人他不愿意去seek professional help？ 虽然他们 struggle 了很久，你觉得有哪些因素呢？
王莹医生，我觉得就是从我的周围的朋友和我的观察哈，我觉得我们中国的就是中国人呢普遍的就觉得mental health 好像是跟那个 craziness 相连的，就是如果去看 mental health 的这个医生，是不是就像有神经病啊，就是一种 humiliation 的感觉，是一种 embarrassment。其实呢，就像你说的mental health is so important to 我们的 life quality, not only to 我们 individual 的 life quality, 对我们家庭，对我们的孩子对我们的 spouse, 对我们的 marriage 都是有非常大的影响哈。然后呢，我们现在的生活的 quality 已经不是像以前我们的父母一样了，就是他们就是在 survival mode。但是我们现在在北美生活，我们有这个条件可以看医生，为什么不能就是像 take care 其他的 organ 一样的 take care 我们的大脑的 health 是吧？我们的大脑 brain health is the most important part of the organ to direct 我们的 whole body 还有我们的生活的 quality 是吧？但是我觉得我们没有足够的重视，我们这个可能是从我们的文化来的吧，就是说觉得有一点 embarrassment， 就觉得去看mental health 好像有一点不好意思啊，所以呢我怕别人笑话什么。当然我觉得现在越多的人重视起来这个 mental health， 尤其是对自己的孩子的 mental health非常重视。但是我觉得我们也应该重视自己的 mental health， 就像你说的，要 set a good example to 自己的孩子哈，重视自己的 mental health， 重视自己的家庭，自己的 marriage 的 life quality， 这样子才会给孩子一个happy 的这个environment 是吧？还有 memory 对他们来说也都是非常重要的。
我觉得你说的太好了。Yeah, and I think you made very, very good points. 你一开始就说觉得好像 there's a stigma， 觉得去看就是mental health 好像就是我有精神，就是 I'm crazy, unless you're crazy, you don't go to see a psychiatrist or a psychologist. 那么 as a psychiatrist, I can tell you, I have some patients who are so successful. They're not crazy at all. And even if somebody comes to see me with psychosis, 就是我们说的精神分裂症啊，或者有幻听、幻想、妄想啊。So what? You need to get treated, and you can still live a very meaningful and fulfilling life if you get it treated. But by all means, not all mental health illness is the same. Not everybody that comes to see a psychologist or a psychiatrist is crazy. There's a whole range of different types of mental health conditions.
对
So we need to do a lot to kind of break free from that stigma.
对，我听说其实有很多就是比较有条件的北美家庭，就是Caucasian 吧，他们会就是很 healthy 的状态，他们也会 periodically 去 check 他们的 with 他们的这个心理医生。其实这对他们的生活和工作的事业上的成功也特别的有帮助。他们有他们的 life coach， 有他们的心理医生。他们 periodically 去见他们就会得到很多的帮助哈。我觉得这个很重要。其实我们北美的很多家庭就是 Asian 家庭也是有这个条件的，因为医疗保险也有这个，比如说每年20次啊、10次啊都可以去看哈或者是 out of pocket 的。但是我觉得我们就是应该重视起来，因为觉得自己的孩子 deserve everything， 我们也 deserve everything 是吧？我们也 deserve a quality of the life。还有自己的 mental health， 只有你 mentally strong， 你才能就是 defeat 生活中的所有的 challenge。所以 appreciate 王莹医生来给我们分享这么多非常好的干货满满的。 继续。
好，谢谢。So I'm not crazy is like the first one that I thought of here. We kind of talked about that. 有些人也会觉得就是说，我现在这种心情的不爽是因为我的生活里边有各种各样的问题 ，life circumstances。你去看医生或者去看一个 therapist， 他们就是跟你谈话吧，或者给你写药吧，他又不能改变任何的，不能解决问题，不能改变我的 circumstances. So I think this is actually an important point to make. You know, life circumstances can sometimes be very difficult, but same circumstances can affect different people differently. When somebody is very depressed, they may not be able to manage stress the same way that somebody who's not depressed may be able to manage. You know, so even if you're under severely like harsh circumstances, if you're mentally healthy, you can find ways to withstand that, and it doesn't have to turn into a tremendous amount of suffering. You can withstand that pain. But if you're not mentally strong, you're not mentally healthy, small adversity can turn into huge disasters. And, you know, a doctor, a therapist may not change your life circumstances, but they can help you develop healthier coping skills. They can help you better cope with the stresses in your lives. So, you know, we can't change your life, but we can help you find ways to manage difficult life circumstances. Some other things I think, you know, we'll cover later on. You know, people are afraid of medications for good reasons. There's financial barriers. We'll talk a little bit about that. It's time commitment. We don't know how to get started. Talk about that a little bit. And some people told me, I've tried it a couple of times before, didn't really help. I don't think I'm going to try it again. 这个呢也值得提一提，因为 to find the right person for you, sometimes you have to try it a couple of times. 就像我们 dating 一样的，也许第一次就是出去 date 和这个人 chemistry 不太 match. 那 it's okay. You don't have to give up on your love life forever. You can try again. Kind of the same thing with a psychiatrist or psychologist. Just because 这个人的 credentials 很高，不代表他一定就是 the right person for you. So maybe you need to try it a couple times to find the right chemistry. So what if it's not us, but a family member who needs help? How do we open up that conversation? How do we get them involved? I want to start with what not to say. I'm sure these things, none of you guys would talk this way. I don't know. But just to demonstrate this point, I want to read some of these things to you. 我觉得好像特别的过瘾，这样子讲话。What not to say. Lecturing. 年轻人不要这么多愁善感，你不要那么敏感好不好？或者说你就这么一大把年纪了，你这么逞强干什么呢？或者 blaming or shaming， 你看你这样自暴自弃，你浪费多少宝贵时间？你这样对得起父母吗？好吧，那我真的是对不起任何人了，对不对？或者是 minimize， 这点挫折算什么呢？你看你这点挫折都没有办法 handle， 那我可能什么都没有办法 handle 了。或者 make assumptions， 你不要担心你面试会失败，失败没有什么可怕的，不可怕。那你怎么知道这个人他是害怕失败呢？也许他担心的是他成功了，然后他成功之后他不知道下面一步怎么走，所以我们不要 make assumptions。cheerlead， 你不会失败的，我老公是最强的。这个听起来好像是信心满满的，但是 the problem is， 也许你老公这个时候真的没有那么强大，也许这个时候他需要的是 permission to fail， 所以说不要再给他压力。或者是 compare， 人家不也是考试吗？你至于像你这样子吗？那人家都能 handle， 我都不能 handle， 那我肯定真的是 worthless。所以说 this is what not to say. And when we look at it like this, it's kind of funny. But some of you may be thinking, oh, I speak like this sometimes, you know, or maybe you may be thinking, this is how my parents spoke to me. What's the big deal? I don't deny sometimes words like these are actually okay. You know, 对于有些人来说，这样的语句可能还会让你感到亲切，因为我们可能成长在 specific cultural context， 已经习惯这样子讲话了，或者我们内心比较强大，我们知道家人和朋友他的出发点是好的，所以具体怎么样包装可能不是那么重要，重要的是我们能感觉到那份关心。所以如果你曾经这样子去说家人，也不要太自责。但是呢，我们还是要了解我们自己的文化背景和其他人的文化背景不一样，和我们孩子的文化背景也不一定一样，或者呢，我们自己可能内心比较强大，能 handle 这个，但是也许别人这个时候内心不那么强大，所以你怎么样子说话还是 make a difference。所以一方面我们不要自责，总是有机会来弥补的，但是同时也要知道我们是要不断进步的，对不对？人总是要不断进步的，所以我们现在来看一看怎样更好的来进行这样的对话。So how to help family and friends who struggle? First, we need to find an appropriate time and place. Consider a private setting with limited distractions when you have one-on-one time, when you're at home or maybe on a walk, so there's not a lot of distraction. We express concern and we talk directly. 为什么要直接的呢？为什么不转弯抹角呢？我觉得呢，就是 when we're direct, we give people permission to directly talk about what they're struggling with. We make it okay to talk about these things. Direct doesn't mean harsh or insensitive. It just means you don't have to beat around the bushes and make it seem like this is something we can't talk about. If you see that they're struggling, you can point out that you see they're struggling. You can use words like you seem depressed, you seem worried. Part of what we want to do is to help them see that these things are okay to talk about, that we can talk about them without judgment. And then it's very important that we ask. We don't just talk. We ask how they're feeling. We ask how they see the situation so that we can understand. And then we acknowledge their feelings and we listen more. We ask more. I think, Jingshan and people that are involved in nonviolent communication are already masters at this. But this is just kind of a reminder. We ask, we acknowledge, we offer help, and we offer reassurance that these things are treatable. And we offer them help to find resources. And then most importantly, we need to be patient and recognize that not everybody is ready. Even if we push, not everybody is ready for that. And they may push you back when you first try. And that's okay. These things don't happen overnight. The important thing is that you have started this dialogue and then you can continue to reach out with offer to help and with offer to listen. So with that, 我想请景山给我们展示一下怎么样用 non-judgmental observation 怎么样子用 showing concerns directly 景山你可以读上面的或者用你自己的方式也可以来跟我们分享一下怎么样子来进行这样的对话。
说最近几个星期都没看到你笑，你好像压力还挺大的。你看上去是不是有些焦虑？
Non-judgmental observation, we're just making observations right now. And how express concern directly.
我担心你现在的状态，我感到这样下去，你可能会撑不住。这个地方担心，有的时候也可以说我很关心你。如果是对方，有的时候对方可能不好去面对，先表达一下关心，可能。
可能你是不是觉得，如果你说我担心，会给他一种负担，就是说这个时候我不想让你担心，所以我就没有办法来流露自己真正的这种状态，就是不要给别人一种压力，是这个意思吗？
是啊。
OK，
可能看情况了。
对，然后
set the stage 上
seek information，
发生了什么事吗？你感觉怎么样
？So we're asking, seeking information， 然后 acknowledgement。
这是真的挺让人难过的。你心情不好有一阵子了，是吧？还真让人着急啊。看得出你很纠结。
然后 offer help。
我能做些什么帮到你吗？愿意再跟我说说吗？心理的痛苦也需要治疗的，我们找心理医生好吗？我帮你联系。
Okay, thank you. Thank you. 如果大家有其他的想法，或者是这方面有自己的这个ideas 的话，也欢迎你。You can type it into comment box. If you have any questions, feel free to ask. Okay, so I'm going to continue for now. So let's say we've decided to seek mental health care. I want to give people a little bit of an overview of what's there, what's accessible. So mental health resources here. In terms of mental health care, there's kind of a range, a spectrum. On the one end, you have 就是门诊 routine outpatient。And then on the other end, 比较严重的就是 inpatient 住院治疗。So my clinic 我自己的诊所是 outpatient clinic。在我的这个诊所里边，如果说是来做 medication treatment 的话，一般是 it depends。如果是刚开始在调整药剂量，然后 trying to control symptom 的时候，见面的频率可能是比较频繁一点 ，maybe every 2 weeks, every 3 weeks。达到维持阶段的时候，当这个剂量已经很平稳了，症状也已经有了一定的控制了的时候呢，可能 every 3 months，每3个月做一次 kind of check in。如果是做谈话治疗 therapy 的话，这个 frequency 也是varies。一开始可能会频繁一点，像 weekly 或者是 every other week 是 usually where we start。然后当渐渐的我们reach a point of stability 的时候，那可能 stretch out the time between meetings. Sometimes people do monthly check-in. 也有一些我的long-term clients, they're doing very, very well. They're very high functioning and they want to check in kind of as a reminder to do a kind of mental health checkup. And so maybe I see them once every 3 months. That's not very frequent, but that happens as well. I think Alice kind of mentioned, some people, they're doing well, but they want to kind of routinely maintenance check-in. So I do some of that as well. So this is outpatient. And then, between outpatient and inpatient, there's also what we call IOP, intensive outpatient treatment, and partial hospitalization. 就是这个是介于 outpatient 和 inpatient 之间的。You don't stay overnight in these programs. For IOP, intensive outpatient, usually 一个星期去2到4天。每次去的时候大概3个小时。In these settings, usually there's a lot of group therapy. So you're sitting there with a group of other people and kind of learning skills together. You may see a psychiatrist, but usually you see the psychiatrist maybe once a week or maybe once every other week. And then a little bit more kind of higher level partial hospitalization. Usually people go 5 days a week and it's a longer day, 5 hours a day. Again, a lot of group work. And you see the psychiatrist maybe once a week, once every other week. And then on the other end of the extreme is inpatient, where you're monitored 24/7 and you can't just leave. So there's a range of different services. So I want to talk a bit more about 门诊，就是 outpatient care. There's different types of outpatient care. If most people, I think, if they have the resources, 有这个resources 的话，可能会 start with 私人诊所。In a private office, you're usually dealing with an individual doctor or an individual therapist. It's more of a small and intimate setting. And, usually the office looks kind of like somebody's study, and there's comfortable couches and you sit right across from the therapist or the doctor. You try to make yourself comfortable and you just talk. In a community mental health 社区诊所, in that kind of setting, it's a larger organization and usually there's many more staff members. There may be some doctors on site, but usually maybe 1 or 2 doctors, but many, many therapists. There's also maybe case managers, social workers who, their role isn't to do therapy, but to connect you with other resources. And there may be peer advocates. So community center is able to provide more comprehensive care. If you're not familiar with the mental health system, they may be able to connect you to different resources in the community. The environment itself may be a little bit less cozy than private practice, but nevertheless, it's a very, very valuable resource. And people that utilize community clinics, they tend to not have as much resources. It tends to be more lower cost. Sometimes it's even free, but it's still an extremely, extremely valuable resource. And, if you're looking for more comprehensive care, by all means, community mental health is a very, very good place. Multi-specialty group medical practice. So by the way, I've worked in all these different settings, and I can tell you all of them have their own advantages and disadvantages. Multi-specialty group 就是比方说我们这边可能有 Capital Health, 它这个 group practice 可能有各种 specialty, 可能有 OBGYN, 有 cardiology, 也有 mental health. Mental health is one of the many services that they provide. The problem with this is that the doctors come and go. So there's usually not a lot of consistency, and it may be very difficult to get into one of these groups. But if you're able to, that's also a good option. primary care doctors, 家庭医生, they actually can be a very helpful resource. 当你没有自己的这个心理医生或者 therapist 的时候, primary care doctors can prescribe some basic psychiatric care, even counseling, but they can also prescribe some basic medications, and they can provide referral. If you're a college student, there's usually college mental health services on campus that can provide both emergency kind of consultation as well as kind of limited outpatient therapy. So that's something to look into as well. Okay, I won't spend too much time here. I already kind of went through some pros and cons of different settings. You know, again, private practice, generally you have more one-on-one attention. Generally the sessions are longer, but it tends to be pretty costly. You may have to wait a long time before you can get in to see a doctor. And usually you're just working with one doctor, at most maybe a doctor and the therapist. There's not a large team. Community clinic, it's usually very affordable, and you may have more resources, but you know, the sessions are usually shorter, between 15 to 20 minutes if you're seeing a psychiatrist versus 30 to 60 minutes if you're in a private practice setting. And the physical setting may be a little bit less comfortable. And then primary care, it's easy to access, but they don't have specialized training. They're a good place to start. And then people also ask me, you know, what's the difference between a psychiatrist, psychologist? I think most of us, you know the difference, but just to summarize, they're both experts in mental health and they can both provide therapy. So I do psychotherapy, but I'm also a medical doctor. So I went to medical school and then I did, you know, 4 years of specialized training in psychiatry, doing therapy, doing medication management. So I approach things from also a medical perspective, and I can write medications and order labs. Psychologists, they have expertise in addition to therapy. They are also very good at doing evaluations and testing, which I don't do. So if somebody wants to do a specific testing for autism spectrum disorder, or they want to do testing for ADHD, I will often refer them to a psychologist to do this kind of testing. They do not prescribe medication, but they have advanced degrees. They're PhDs or, you know, PsyD or educational doctorates. And a lot of them are very well versed in specific types of therapy modalities and have experience in doing research. So where do you start looking? Maybe start with your insurance company. If you want to use insurance, call your insurance company to get a list of in-network doctors. Keep in mind, this list is usually not very accurate, unfortunately. If you do call your insurance company, ask if they provide case manager. If there's a case manager, they may be helpful in maneuvering the system for you. Also ask if you have an employee assistance program. Some employees offer that and they may cover the cost for the first couple sessions that you'll have. Not everybody has that, but definitely ask. Psychology today is a very useful resource. You can go on there and you can search for a therapist or psychiatrist. You can filter by location and insurance and a lot of other factors. You can go to your primary care doctor and ask for a referral. Campus mental health services I've mentioned. Another thing for people that can't find a private practice doctor, you can consider online doctor options. So there's Amwell. I actually worked for Amwell for some time. Just Google Amwell and then you'll be able to find their database of doctors, and they do take a lot of insurances. Also, there's one called Teladoc, and then there's also one called Better Health. I think Better Health is just for therapy, but Amwell and Teladoc also cover medication treatment. For people that don't have as much financial resources, I've listed some resources on here. Maybe later, you know, my slides will be available. You can go to these sites, but typically you want to search your state department or state's Department of Human Resources for free mental health care. Some insider tips. There's a shortage of psychiatrists, as you know, you guys may know. So a lot of times when you try to get in, you may be put on a wait list. The wait list could be many months long. While you're waiting, ask them if they have a cancellation list. I do this a lot. So if somebody cancels, then I call people on the cancellation list. I may be able to get them in a lot sooner. So ask to be on the cancellation list and checked frequently. When you're trying to decide which doctor or which therapist to go with, ask them, how long are your sessions? Are they going to see you every time, or are they going to have, a physician's assistant seeing you or someone else seeing you? Ask them, how do you communicate between sessions? Some doctors give out their numbers, some doctors give out their email addresses. So, find out how they communicate with you and see if that's acceptable. Confirm their credentials. You can check to see if they have a valid license number, if they have a valid NPI, where they graduated from. These are important, but also remember, credentials themselves don't mean everything. Sometimes a lot more important is, what's the chemistry like? Do you have good rapport? Do they seem to be nice? That's really important. And also keep in mind, it's okay to switch providers. Sometimes you need to try a couple different ones. Sometimes you need to call a couple different ones to get a sense of what are they like. And it's okay to be picky. The other thing that's kind of important to remember is you may actually feel worse before you feel better. Think about it. When you go to a therapist, you're forced to confront things that are difficult to confront, right? So in that process, feelings are stirred up. So in the beginning, it may actually make you feel a little bit worse, but the goal is that you'll eventually feel better. So what does an appointment look like? Just very quickly, if you go to a private office, like mine, you start in the waiting room where you sit, and you don't go and knock on the door. You sit in the waiting room, because if the door is closed, it means the doctor is with another patient. So you wait, and then when the doctor is ready, they'll come and take you into their office. And then once you're in their office, make yourself comfortable. The sessions typically in a private setting are 30 to 60 minutes. My initial evaluations are usually 60 to 90 minutes. And during that time, I'm not necessarily doing treatment. I'm trying to get to know you and make a diagnosis. And then we come up with a treatment plan. And usually the first meeting doesn't mean that you're going to work together. It's a chance for the doctor to assess you and to come up with a treatment plan. And it's a chance for you to assess, is this doctor somebody that you want to work with? So the initial visits are usually longer. Follow-up sessions, if for me, 30 minutes for medications and 50 to 60 minutes for therapy sessions. Once the meeting is over, you make your follow-up plans. You decide, when am I going to come back? The doctor may write a script for you. They may also write labs for you to rule out medical conditions. I'm not going to go into details here, but just remember, psychiatrists, sometimes they also want to look at other aspects, not just mental health, but physical health. So do we do meds? Do we do therapy, right? For me, I think it really depends. Depends on your diagnosis, 你的诊断，因为有些诊断它是用药是必须的，比方说，像 bipolar 双向情绪障碍，像 schizophrenia 精神分裂症，像这些病的话，光用谈话治疗肯定是不够的。如果诊断是抑郁症、焦虑症强迫障碍等等，这些我们要看 symptom severity。如果症状比较轻，工作和生活还可以进行的话，一般我们建议是先从谈话治疗开始。如果已经比较严重了，影响到生活了，那么药物治疗就有必要。药物治疗和谈话治疗它并不是相对立的，很多人他用了药物以后，他能更好的参与或者利用这个谈话治疗，因为谈话治疗它需要你有一定的这个参与能力和吸收能力。当你特别抑郁、特别焦虑的时候，你对事情的吸收能力会受到影响，所以呢，有的时候是 we have to use them together。当然了，我们用药的时候，用药物治疗的时候，需要定时 reassess， 看看有没有副作用，有没有起到我们所期望的效果，衡量一下它值不值得继续，剂量需不需要改变等等。不能否认，我们确实要考虑药物在帮助我们的同时，会不会给我们带来一些不利，这个一定要跟你的医生谈。然后呢，不同的药它会有不同的副作用，有些药它是可能会有依赖性的，但是大多数常用的精神药是没有依赖性的。容易产生依赖性的药通常是安眠药、镇静剂等等，这些药呢确实应该少用，不能长期用。但是绝大多数的精神药物，比方说抗抑郁症的情绪稳定剂、抗精神病药，这些药没有依赖性。那么大多数副作用是在开始用药一开始头7到10天会比较明显，比较常见的 side effects 包括头痛、肠胃不适、瞌睡这些。那么这头7到10天过去以后，一般大多数人他都会这些副作用会渐渐的减缓或者是 disappear。 都会能适应的，但是可能会有一定的过程。那么你应该及时的和医生沟通，反映你对药物的感觉。如果副作用太大了，可以把剂量调小，然后减缓这个加剂量的速度。如果副作用太强的话，也可以换药。那么有些副作用是一开始你能感觉到的，也有一些是用了一阵子以后才会产生的。所以呢，我们要定期的复查，然后呢，定期的检查一些指标。像我一般是每6到12个月会要求病人去查一下他的胆固醇、血糖等等这些指标。在用药之前，一定要和医生好好的交流，问清楚了哪些短期、哪些长远的这个副作用需要 monitor 的。还有一点值得讲的就是，每个人对药物的反应不一样，并不代表说别人有这个副作用你就一定要有。你对副作用的反应一大部分取决于你的这个基因的结构。亚洲人对药物的承受能力和对药物的代谢和白人比起来是有一定的差别的。Asians tend to be actually more susceptible to certain types of side effects because of being poor metabolizers of certain antidepressants and certain mood stabilizers. 这并不代表说亚洲人就不能用这些药，但是呢，我们可能要更关注我们的反应。有些药呢，我给亚洲病人开的时候，我会非常的谨慎，开始剂量会比一般的人要小，然后 titration 会比较慢一点。OK， 那我们刚才谈的就是
大部分药物其实是没有这个就是人种上的问题的。
对，大部分是没有的。A couple， 一个是 Lexapro、Celexa， 这是有一些，还有一些这个 mood stabilizer。A couple， 大部分是没有的。对，你说的是对的。OK， 那这个谈话治疗又是怎么一回事情 ？What does it involve？ So， 第一个，它是一个这个倾诉的渠道。当心理问题被说出来的时候，它本身就有一定的治愈的作用。It's like when you have a pot of boiling water, when you lift the lid and let it out, the pressure is relieved. 所以就是谈话本身它就是一种治疗。当你的痛苦被看见的时候，痛苦本身也会有一定的减轻。但是一般来说，我们的谈话治疗不仅仅是倾诉。Sometimes therapy can be used to help people develop coping skills like mindfulness, relaxation techniques, grounding techniques. 我们可以通过 therapy 学会怎么样放松自己，不那么暴躁，怎么样平息自己情绪。然后更进一步呢，谈话治疗可以帮助我们发现自己思维模式是不是出了问题。往往我们的痛苦并不是来源于真正的苦难，而是来源于我们这个思考问题的方式，我们对事情的理解。所以这个 therapist has a role in helping us examine our own thoughts, our thinking style. 然后呢，帮助我们发掘更加健康的、智慧的思维方式。Another big part of therapy is examining our relationship dynamics. 我们对人和事的看法，以及我们和别人交往的方式和这个 relationship dynamics， 往往来自于我们原生家庭对我们的一些影响，以及我们的人生经历。所以 therapy will often involve us examining important relationships, the way we grew up, how we view our relationships, and how we form relationship dynamics. Through these kind of examinations, we can form healthier relationships and more effective ways of being with other people. So talk therapy isn't just limited to these things that I've mentioned here, but I wanted to give you kind of a bird's eye view of what talk therapy is about and what it aims to do. So there are different types of talk therapy. And as I mentioned, today I want to focus on CBT and DBT, in part because the principles of these therapy modalities can be applied without a therapist. 你就是没有心理咨询师或者是心理医生的话，你也可以自己应用一些这里边的 technique. Okay, so should we get started with this, or do people have questions about the first part? Because 现在我们就是进入下面一个这个环节，就是比较具体的讲一讲 CBT 和 DBT. It's kind of a change. What do you guys think? Should we continue, or is there any questions at this point?
聊天框里其实已经有一些问题了，我们要不要
？OK， 我要不要看一下？哎，我怎么没有看见呢？
可能你在 share screen 的时候你就不容易看见。
OK。chat OK 看见了。
你看见了
OK, so I'm looking. Now that's very nice. A lot of people are sharing their experience. 有一个问题就是有抑郁症、躁狂、焦虑症， 很长时间找不到医生，每天很痛苦，我可以怎么样子帮助自己？怎样找到医生？这个的话，I don't want to put anybody on the spot， 就是说有没有我刚才就是suggest a number of things. First, starting with insurance company. Insurance company usually will tell you who's in network for you. 然后 insurance company 如果没有办法找到的话，可以我刚才 list 一系列像什么 Amwell、Teladoc 这些 online services 它都会有。Both psychiatrists and therapists, 你可以试一试。Even community mental health centers sometimes can get you in a little bit sooner. 至于说就是每天有抑郁和躁狂，这个的话，躁狂它I can't make a diagnosis of bipolar， 所以说我觉得第一步还是要诊断，就是有没有真的诊断下来。如果真的是有躁狂和抑郁的话，那就是双向，就是 bipolar depression、bipolar disorder。那这样的话，自助就是说 there are some things we can talk about, with self-help， 但是遇到这种情况还是需要用药的。With bipolar, medication actually is very necessary. 所以这个的话，第一步还是需要 diagnosis. What to say after they express their problems or concern? What can we say other than mentioning professional service?这个问题我不是很懂是什么意思。What to say after they express their problems or concern? Does anybody 就是我在看这个李楠，
我可以帮我可以帮这个听众解释一下吗？因为他这个问题 post 出来的时候，就是当时王医生正在给我们显示那个 slide 上，就说我们可以说什么，就是说。就说不要说那些 blame 的话呀，那些评判的话呀，而是要说那些就说关心的话呀，理解的话那些。然后他就说
我读了那些。
景山后来对，
所以他的问题就是说，除了说了那些以后，那接下来我们又能说什么呢？
接下来又能说什么 ？OK， 那接下来的话，你可以就是 you can ask them what do you think? Are you willing? I mean, a lot of it depends on what this person's response is. Maybe what they need is 这个时候他可能是希望能进一步的就是empathic listening， 你是不是希望我们继续谈一谈？你有没有更多的愿意跟我分享的？你可以问一问，或者说，那你这个时候你需要我做些什么吗？我怎样子来帮助你？Do we move into the action phase? Do you want me to actually help you look up professional services? I can do that. Or would it be helpful for me to listen more? Would it be helpful for us to go for a walk together? Are you having trouble maintaining, day-to-day life, like cooking for yourself? What can I do? Basically ask, what can I do? What would be helpful to you? I think a lot of this really depends on the dynamic and the moment. And the important thing is you ask questions and you try to get the other person to let you know what it is that they need in the moment.
就是那些我读了那些句子之后，也有可能是，如果对你的家人朋友他开始说了，你可能就好好听就行了吧？
对，
因为你说的目标是让他告诉你 what's going on， 就他们正在发生一些什么，遇到一些什么样的困难。
Yeah。
王医生你好，我是 Laura， 我看了 chat 里的问题，我就总结一下，就很快的请你 address 一下两个问题，然后我觉得我们就开始下面那个 CBT 的部分哈。这两个问题，第一个呢就是说你今天的 slides 有没有可能就是跟大家分享？
可以的。
好的，谢谢。那我们 PCE 我们会跟王医生联系，把这个 slides 和大家分享。第二个问题就是就是关于找医生的问题，我想那个也许我们可以留到最后，也许请你一起最后一起回答，就是因为社区里华人社区里会有挺多人就走出这个第一步去找医生，可能还是会觉得有一些挑战，也许那个我们可以留到最后再 address。我觉得你现在可以就开始下面第二部分，非常感谢，很精彩。
好的，好，那我们开始说从 CBT 认知行为疗法说起。CBT 可以说是一线治疗，它很有效，而且呢相对来说也比较容易懂，所以我比较喜欢讲这个。如果你对这个已经有了解了 ，bear with me，OK？So CBT is
一线治疗就是说。医生就是首选，
对， 对 yeah usually when somebody's anxious or depressed, this is where we start usually. So CBT is based on the fundamental principle that the way we think affects how we feel and the way we behave. 就是我们的认知，我们的思维主宰我们的情绪和行为。认知就是指我们对事情、对自己以及对周围世界的这个理解和见解。So when we have bad feelings and destructive behaviors, it's not really the situation itself that makes us feel bad or do bad things. It's more how we think about that situation. So a quick example, let's say you're waiting to be seen by your doctor. You're waiting in the waiting room and it's 30 minutes past your appointment time and you're getting really impatient. Now, if you're thinking, this is ridiculous. Why do they have no respect for my time? They clearly don't care. They just want to make more money, so they book more people. Then you're going to be feeling what? You're going to be feeling angry. You're going to be feeling frustrated. Maybe you're going to be feeling mistrustful, impatient. And so how's that going to affect your behavior? You may be grumpy. You may be demanding with the office staff. Some of you may actually just get up and leave and never come back. Some may sit and stew in silence and then carry that negative energy to the rest of the day and maybe lash out at somebody else later. But if your thought at this point is, wow, this doctor, he's really popular. He's in demand. Everyone wants to see him. He must be a pretty good doctor. I'm pretty lucky that I got an appointment today, at least. This brings about very different feelings, right? You may actually be feeling lucky. You may be feeling full of gratitude. Or you might think, this poor doctor, he's so overworked, or this, there must be some really difficult case going on that's taking up so much time. That's usually what I think, because I know that if I have a really difficult case, sometimes I go beyond the appointment time. So my mind goes to, oh no, something's bad's going on. So at this point, you may be feeling concerned. You're probably feeling more empathic, and your behavior will show that. Now, if you behave in a grumpy and confrontational manner, you're going to piss people off. The office staff, they're going to get mad at you too if you act all pissy, right? So they could really get disrespectful with you in return. And then you get more angry, more grumpy. And then you fulfilled your own prophecy. So you see, your thoughts, your emotions, and your behaviors, they really feed off of each other, sometimes in this vicious loop. So to disrupt that loop, we can intervene anywhere in this triangle, any point you can intervene. But the focus of CBT, the soul of this method, is that you focus on find thought distortions that give rise to negative feelings, and you replace distorted and dysfunctional thoughts with more balanced and realistic thoughts that are based on real evidence as opposed to based on our fears and projections. So this in turn leads to fewer negative feelings and healthier behaviors. We're not saying erase all bad thoughts or feelings and just pretend everything's great, everything's sunny. It's not that. It's about realizing when we're focusing too much on the worst case scenario and engaging in unhealthy thinking patterns. So how do you know if your thoughts are distorted? You ask a bunch of questions. Like in this case, if you're thinking, they really don't care about my time, they disrespect me, that's why they're late. Maybe they're sitting there eating a big lunch or on the phone or something. You ask yourself, well, are there other possibilities? So these questions, are there other possibilities? Could it be something else going on? What's the best case scenario? What's the worst case scenario? And what's the most likely scenario? Do you have any evidence for or against these thoughts that you're having? And how does this way of thinking serve you? Is it helping you in the moment, or is it hurting you? And then you take a step back and you say, if it's not me in this situation, if it's someone else, what would you tell them? How would you counsel them? Right? So these questions, they make us evaluate our thinking process. They make us reassess, 就是我们这个思维的这个是不是合理？它强迫我们进入这种 Sorry, I'm switching back and forth Chinese and English. 它强迫我们进入这个就是逻辑思维的这个状态。当我们进行逻辑思维的时候，我们的情绪就已经稳定下来了。因为用逻辑思维的时候 we're using a different part of the brain, the prefrontal lobe. Our amygdala, the emotional center, has to quiet down because we're redirecting our energy to a different part. 那么这个时候我们就没有那么暴躁了 and we're able to see things in a more balanced manner. So while we're focused, like I said, we're focused on thoughts and thought distortions, it's also important to realize that sometimes we're not even aware that certain thoughts are popping up. What we're usually aware of is the emotion, the feelings part. We know that we're agitated. 我知道我发怒了，让我等这么久，我当然要发怒，对不对？ But we may not be aware that the real problem is that the way we're interpreting the situation is we're not respected, we're not valued, we're helpless, there's nothing we can do. And what makes one person interpret the situation as being a helpless victim who's not respected, while another person thinks of this as, oh, I have a pretty popular doctor, or another person thinks, oh, this poor doctor is so helpless and overworked. Why do people have such different automatic thoughts? It comes down to our core beliefs about ourselves and the world around us. If we tend to believe that our value comes from other people's validation, if we feel that we have little control, then we tend to see situations through the lens of worthlessness and helplessness. How do we change that? We recognize our thought distortions and reframe them, but more importantly, we need to examine our core beliefs and ask, are these beliefs really consistent with how I want to be and how I want to feel? So we identify our thought distortions, we challenge them, and then we also want to think about why we have these kinds of thoughts. What are our core beliefs? And is my core belief that I'm helpless, I'm not in control? Is that why I keep thinking this way? So let's take another example. Let's use another example to kind of drive this home. Let's say we have our client today. Let's say our client is Alice. All right, Alice, I'm going to use your name. Let's say Alice, she walks into a restaurant, 进入一个餐馆 ，OK， 然后她发现一个 corner 有一个男子给她一个很奇怪的目光，好像是敌意的目光，让她一下子就不自在了。那我们先从 feelings 开始啊，就是说，因为 feelings that's the most immediate kind of recognizable thing that we have, okay? So 这个时候 Alice 的 feeling 可能是什么呢？可能是 anxiety 紧张，可能是不安，可能是困惑，可能是 shyness 那个害羞。那我下一步我们就要问，就是 what thoughts made her feel this way? All right. The way we search for these thoughts would be, we ask, 我在想什么？我害怕会发生什么？那 what kind of thoughts is Alice having at this moment? I'm just going to guess. And feel free if you want to type down some thoughts that you think could be contributing to her feelings. But I think, she might be thinking, 这个人是不是看不惯我？他是不是不喜欢我？是不是我什么地方做的不对，我 offend 他了？是不是我穿的不得体，让他这样子来看我？是不是我的行为让人家觉得讨厌呢？是不是别人觉得 maybe I don't belong here, right? So these are the different types of thoughts that she may have that makes her feel that way. So once we've identified these thoughts, we pause and we ask a bunch of questions about these thoughts, right? So one of these thoughts was 这个人他不喜欢我，他看不惯我。那么我们就问，我们有证据吗？我们的证据可能就是他这个好像敌意的目光，也许我们曾经有过这样的经历，曾经被别人这样敌意的看过，然后事实证明那个人就是对我们很凶，不喜欢我们。那我们下面一步就是要问 So does your past experience, is that enough evidence for what's happening right now? Do you have clear evidence that this person was really looking at you strangely? Did you see his face clearly even? How closely did you look at him? Are you sure he's looking at you, or maybe he's looking at somebody behind you? Or maybe he's not looking at anything in particular, but maybe just having a bad day, probably. Or maybe even let's entertain the possibility. Maybe he's looking at you because you're beautiful. Maybe he's looking at you because he's attracted to you and he's just kind of an awkward guy. He can't help himself. He's just kind of staring, right? That's also a possibility. So at this point, we have listed quite a few alternative explanations for the situation. We've asked for evidence. And what we're really doing is just stepping outside of our narrow focus on the worst case scenario. And we're seeing things in a more balanced light. 会不会有可能这个人就不喜欢我，对我很敌意？当然有这个可能，但是这不是唯一的可能。There's a lot of other possibilities. So when we're looking at all these possibilities, we stop focusing on the worst case scenario. 然后我们就不会无止境的沉浸在这种负面的情绪里边。So let's go to the worst case scenario, okay? In this situation, it would be that this guy really has something against Alice for whatever reason, and is giving her a mean look. We ask, so what? So then what? Does one person's mean stare have to ruin your meal? Would it be possible still to socialize in the restaurant with your friends despite one person being quietly angry with you? let's say you end up not having a good meal. You couldn't really socialize because you're self-conscious because of this guy. Does this have to ruin your evening? All right. Even if it ruined your evening, even if your evening turned into kind of a bummer, then what? Does this have to ruin your life? Does this have to destroy you? Right? It's kind of ridiculous when we kind of, pull it into these kind of strands, but sometimes that's what we have to do in the worst case scenario. So what, my evening is kind of sucky, but it doesn't have to destroy me. Right? Do you have to be liked by everyone to be a functional human being? So what if this guy doesn't like you? No, we don't have to have everybody like us, right? We may not like the fact that someone doesn't like us, but ultimately we're going to be okay. We don't have to be liked by everyone. If he doesn't like me, it's his problem, right? It's his loss. So again, this is, is an example of when you engage in this kind of thinking of stepping outside of that narrow focus and asking all these other possibilities, you make yourself think more logically, and then you calm down that fight or flight brain that otherwise would be taking over. Okay, so again, CBT helps us identify thought distortions that cause negative feelings and maladaptive behaviors. Oh, I mean, I forgot the behavior part, right? So if you're feeling anxious, if you're feeling kind of scared because of these thoughts that you have, it's going to affect how you behave. You're going to be more self-conscious. Maybe you don't talk as much. Maybe you leave the restaurant, and then you're really going to feel kind of crappy, right? Because this did ruin your night versus, okay, maybe he likes me. Maybe he thinks I'm cute. All right, I'm going to be more flamboyant. Maybe I'm going to talk louder. Maybe I'll have a more fun evening. So again, there's this feedback loop here, and the way you think, the way you feel affects how you behave, and vice versa. So CBT helps us identify thought distortions. There's some very common thought distortions that, whether or not we're, ill, we all have these thought distortions, but some of us do this more than others. So some examples here: black and white thinking. For example, if I don't get into this college, then I'm a total failure. That's black and white thinking. Or let's say I'm on a diet and I'm watching what I eat, but today I ended up eating a little more than I wanted to. I might say today was a total failure. It's a lost cause. At this point, I might as well just pig out and eat everything because the day is ruined anyway, right? Black and white thinking kind of ruined it. Mind reading is another common one. That's kind of what Alice did in this last example, right? I can tell this guy doesn't like me. Well, how can you tell? Sometimes we can tell, but oftentimes we're not very good at judging what people are actually thinking, but we think we can. We do this mind reading. Another one, overgeneralization. For example, he disagreed with me on this topic, so he's going to disagree with me on everything. That's an overgeneralization. Catastrophizing. For example, okay, I'm going to use myself as a catastrophizing person. 就是说，如果我的今天这个 presentation 有个地方没有讲清楚，或者我用错了一个词，中文没有讲好，那人家会觉得我是个笑话，那以后就没人信任我了。那我诊所还怎么开了？我诊所开不下去的话，那我以后生活怎么办？我孩子生活怎么办？完蛋了！如果我这个 presentation 里边有不完美的地方的话，那我们家的前途就毁了。So this is a totally exaggerated way of catastrophizing. It sounds ridiculous. But believe it or not, we all do this from time to time, and some of us do this all the time without realizing it. Once we've identified our thought distortion, then what we need to do is reframe that distorted thought into a more reality-based and balanced thought. Okay, so with my CBT patients, I will often ask them to do a thought record in between sessions. This is a way for them to keep track of their thoughts and to keep track of some of their common thought distortions. This is like homework for them. You should feel free to do something like this yourself. If you just Google CBT thought record, you'll find all different types of forms online, but this is something that I use. You just write down what's the situation that triggered a certain feeling, you write down what kind of feeling you have, and then you document like common distortions, and then you look for evidence and counter evidence, and then you reframe your thought. So it doesn't have to be this format, but something like that. The important thing is you keep practicing it. You do it to a point where it becomes automatic. Okay, so that was kind of a quick overview of CBT. As awesome, I love CBT. As awesome as CBT is, sometimes it's not enough. Some of us just can't benefit from it. Why? Because CBT emphasizes change, which comes from identifying what is wrong, our thought distortion. And this emphasis on change and finding distortions can feel invalidating. can feel like rejecting people's current experiences. And sometimes it may create hostility between the patient and the therapist. So you can see constantly being pushed to think and act differently is kind of hard, and it could be annoying for anyone. But even more so if somebody is already suffering tremendously and in a state of crisis. And also just for people who are really, really sensitive, they may perceive this constant push as rejection, as ongoing rejection and criticism. As a result, they may have a very hard time engaging in this kind of therapy. And that's how DBT, Dialectical Behavioral Therapy, was born. So DBT is actually a modified version of CBT that incorporates acceptance of things as they are. So dialectical means integration of opposites. It means balancing acceptance and change so that we can look at two very different perspectives and think of them as both being valid. So acceptance in this case is achieved through validation of somebody exactly as they are in the moment. The DBT therapists really believe that everyone is doing their best that they can given their unique circumstances, and that their feelings, however destructive they may be, have validity. And yet with that, they guide the patient towards change. So the acceptance part of DBT has its roots in Zen Buddhism, with the idea that we accept reality as it is without attachment, without judgment. This acceptance applies both to the therapist in that they fully accepted the patient as they are in the moment, but it also applies to the patient in that they radically accept their reality as it is. All right, no matter how sucky this reality is, they accept it as it is. It is what it is. Through this acceptance, the therapist and the patient, they're no longer on opposing sides. They're joined together and they work towards change together. And the change part involves principles of CBT, which we talked about, as well as a lot of other problem-solving strategies. So this balancing of opposite sides in DBT is captured by the idea of walking the middle path, which is actually a Buddhist concept as well. Embracing the middle path means that opposing views can be valid at the same time. So no one has the absolute truth. So we better all be open to alternative ways of thinking and stop blaming the patient, stop blaming each other. All right. So DBT is the opposite of black and white thinking. It's the opposite of all or nothing thinking. So, for example, we can both engage in self-improvement and practice acceptance. Even if I'm fighting with my husband right now, we can both be right. I could be right and he could be right. I could be independent, but I could also accept help. I can take care of myself and engage in self-care, but also be someone who cares for others. I can have very conflicted feelings. I can hate somebody, but I can also love them at the same time. And both of these feelings can be equally as valid. So dialectical behavioral therapy consists of 4 skills modules, and 2 of them involve acceptance. So they're the mindfulness and the distress tolerance modules. The other 2 modules are change-oriented. They include emotional regulation and interpersonal effectiveness. So mindfulness is the practice of being fully aware and present in this one moment. It involves meditation practices and learning to focus on one thing at a time without judging yourself or others. Distress tolerance is about how to tolerate pain in difficult situations and not change it. This may be very helpful for people that have destructive and impulsive behaviors like self-injury. It teaches you constructive and in-the-moment alternatives. These could include things like distraction and other self-soothing techniques like deep breathing exercises or listening to music, etc. Emotional regulation means decreasing vulnerability to painful emotions and changing emotions that you want to change. And finally, interpersonal effectiveness means how to ask for what you want and say no while maintaining self-respect and relationship with others. All right. So because we've already spent a lot of time talking about change because of CBT, I want to focus more on the acceptance piece right now and talk a little bit more about the acceptance modules. So starting with mindfulness, what does it mean to be mindful? It means being aware intentionally in the present and without judgment. If we're not aware, we operate on autopilot. This can cause us to drift into past regrets or future worries and leave the present. We've all had experiences when we had one thought that led to another, and then before we realize it, our minds have taken over. You know, it could go from my kid forgot to clean up to he is so irresponsible to how is he ever going to manage life on his own to I failed as a parent, right? Can go like that really quickly. And as a result, instead of assessing what's really important and figuring out what you need to do in the moment, our minds have completely taken over and we feel out of control, resentful, and helpless. When this happens, we're not being mindful. In DBT, there are 6 core mindfulness skills. They're divided into the what skills and the how skills. So to be mindful, we first observe. We observe what is around us and what is inside of us, like our thoughts and feelings. Then we describe and label these observations. The act of describing helps us stay in the present. It also helps us take a step back from our thoughts and feelings. So instead of saying, I'm so angry, I can't take it anymore, you label it as, I'm having a feeling. That feeling is called anger, and that anger is pretty intense. You can also say, I'm having a thought, and that thought is that I might not be able to handle my anger. So again, you're labeling. This helps you detach from that thought itself and that feeling itself so that we don't drown in these thoughts and feelings, but we recognize them and we figure out how to manage them. All right, so we observe, we describe and label, and then we participate fully. We often try to multitask. And in that process, our minds go all over the place and we miss out on the present. So when we practice mindfulness, we pick an activity and we fully participate in it. All right, so these are the what skills. And then we have the how skills. We take a non-judgmental stance. We naturally judge, we're human, it's natural to us. But when we practice mindfulness, we take the judgment out of it and we stick to the facts. So instead of saying, I feel awful, I'm ashamed, you can say, I'm having a feeling. My chest is heavy, my heart is beating fast, my face is red. You stick to the facts. And then we act one-mindedly. We don't multitask. This is kind of like the fully participate. We do things one-mindedly. We don't eat and watch TV. We eat and focus on the food. We focus on the taste and the texture. We don't talk to our kids while looking at our phone. Not that I don't ever do that. Sometimes I do that. But when we're trying to be mindful, we don't do that. We focus on them one-mindedly. All right. And we choose effective behaviors. If something isn't working for us, we don't get mad at ourselves. We don't punish ourselves. We don't blame ourselves. We switch gears and we try something else. So there's so much to mindfulness, and it's a huge part of DBT. So I'm just kind of providing a bird's eye view and a quick intro to mindfulness. One way that we can cultivate mindfulness is through meditation. One of the simplest way to meditate is actually to focus on the breath and breathe in and out using your abdomen. Abdominal breathing means that you're intentionally expanding, pushing out your belly when you breathe in and contracting your belly when you breathe out. So you don't have to worry about this, but for those who are interested, this is actually really neat to take a look at what actually happens when you breathe with your belly. When you inhale and you push out your belly, you're lowering this thing right here called the diaphragm. Whoops, sorry, let's go back. What happens is that this diaphragm, this muscle that sits on top of your stomach and it's right at the bottom of your lungs. You don't see the lungs here, but lungs would otherwise be here. When you're inhaling and you're pushing your belly out, the diaphragm moves down. So this muscle moves down. It's like you're pushing on a balloon and the balloon pops out, right? So the belly pops out. But when the diaphragm moves down, it also increases the lung volume. So it draws air in. And then when you exhale, you lift the diaphragm up, you're engaging the diaphragm, and that causes your belly to contract, and then it expels all the air out of your lungs. Not only is this a more efficient way to fully expand and contract your lungs, so you're doing good air exchange, what's really cool about this is, I don't know if you can see, but you can see some yellow branches here. These are branches of the vagus nerve. And these branches, they ride on the esophagus and they go through the diaphragm and they go innervate your stomach. So when you move the diaphragm up and down, you're stimulating the branches of the vagus nerve right here, and you're activating them. And what happens when you stimulate the vagus nerve or branches of the vagus nerve is that you're activating the parasympathetic system. And that's the part of your central nervous system that's responsible for relaxation, what we call rest and digest, as opposed to the sympathetic system, which is responsible for fight or flight. So when you engage your abdomen, when you use your diaphragm to breathe, you're actually massaging parts of the vagus nerve, and that helps send relaxing signals throughout your body. And you can't help but feel relaxed. You can't help but have your heart rate be lowered and your blood pressure be lowered. And when our bodies are relaxed, our minds can also quiet down. All right, so one way to practice abdominal breathing, I know some of you already know this very well already, but for those of you who don't, one way to practice this is to put one hand on your chest and then another hand on your belly. So 2 hands against your body. And when you breathe in, you want to feel the lower hand move out and in, and the upper hand should move very little, if anything at all. So if you're feeling your bottom hand moving out and in, and your upper hand is not moving very much, then you're appropriately expanding and contracting your abdomen. It may not feel natural in the beginning, but it takes practice. Again, don't get mad at yourself. Don't blame yourself. Just practice it. Sometimes it's easier if you lay on your back and put your hand on your belly. Then it's easier to feel the rise and the fall in your belly. Takes practice, but it's well worth it. Abdominal breathing can be a very miraculous way to lower stress levels and feel more relaxed. And it's a very good way to bring a state of mindfulness.
就是腹式呼吸的话，是那个肚脐眼那一块要鼓起来。
对，
你吸气的时候。
对 ，exactly。
这样可以帮助你放松，从那个神经方面有一些解释。
对。这个地方是不是我这个全是对不起？
因为有人想要听中文，所以我简单的说
啊。OK， 对 ，OK。
那我们可以下一个。
OK. So controlled abdominal breathing, it's a basic meditation technique that I just talked about. Okay. So when we focus on the breath, our body relax, our minds will not run wild. We're more likely to stay present and not run to a future. All right. I have a little cartoon here to illustrate how mindfulness can actually help. It's very simplistic, but I think it can demonstrate the point. Let's say there's something that's very stressful and anxiety laden. And when we're not in a state of mindfulness, our minds go to, what if this happens? What am I going to do? What if it doesn't work? How can I fix this? What if? So a lot of thoughts just kind of, pop up automatically. We're on autopilot, and we can very quickly become overwhelmed and get into a state of crisis. And we start to think, I hate myself. My life sucks. It'll never get better. Tantrum, right? So we can be in this kind of a state if we're not mindful. However, if you take a mindful approach, if instead you don't drown in these thoughts and you sit down and you kind of detach yourself and you make observations and labeling, you can say, I'm having a thought. My thought is that my life sucks. I'm having a feeling. That feeling is I'm feeling sad. I'm having this behavior of I'm wallowing. So instead of becoming one with these thoughts and feelings, you take a step back and you observe them and you label them. And then you can say, all right, well, having made these observations, what is an effective thing to do? Is wallowing really effective? Maybe I should go for a walk instead. Right? So then you can more likely maintain the presence of mind to make a decision about what to do. So you're not operating on autopilot. You're mindful about what's happening, and then you can pick an appropriate coping strategy. So we've been talking about mindfulness. Let's also talk a little bit about this part, distress tolerance. So again, distress tolerance means getting through difficult situation without making it worse and accepting reality as it is. We do this through something called radical acceptance, which means completely accepting with our minds, our body, and our spirit that we cannot change the present, all right? This doesn't mean approval, and it doesn't mean resignation or helplessness. It means that we recognize that the pain is inevitable in life, and that we will endure it because we're human. So that we don't constantly go, this is unfair, how can this happen to me, why is this happening to me, etc. When we do that, we intensify this pain and we enter into what we call a stage of suffering. So there's a difference between pain and suffering. Pain is inevitable because we live an unpredictable life. There will be pain, but this pain can be intensified if you constantly question it. If you constantly say it shouldn't happen, why is it happening? Then you start really suffering. All right. And we suffer less if we just accept this moment and let go of the expectation that it has to be different. Another way to think about this is When you stop fighting reality, you free yourself up so that you can focus on what you can control instead of fighting what you cannot control. Only then can you take your first steps towards change, right? So we stop fighting with reality. All right, so we accept reality. We are not fighting it. This frees us to sit with the distress. But what if this distress is too intense? How do we get through it? How do we tolerate intense distress? DBT is all about different coping skills and different, tolerance skills. One of them, I'm going to share here, acronym TIP. So you tip the temperature of your temperature with your face in ice water to kind of calm yourself down fast. It's instant stimulation, and it can help to shock you and calm you down. So sometimes I can have people hold their breath and put their face in a bowl of ice water, or just hold an ice pack to your eyes, to your cheeks, and hold it there for 10 to 30 seconds. Intense exercise, this can calm down your body when it's really revved up by emotion. Engage in whatever intense exercise you like. It could be a run, it could be doing jumping jacks, it could be playing basketball, whatever. Just get that intensity out of your body. Paced breathing. This is kind of like the belly breathing, the abdominal breathing that we were talking about before, but you do it intentionally and really, really slowly. In general, we want to breathe out more slowly than you breathe in. So for example, you can do 5 seconds breathing in, hold, and then 7 seconds breathing out. It's helpful to have the exhalation be a little bit slower than the inhalation. When we get really anxious, we have a tendency to engage the chest muscles and then to breathe fast and hyperventilate. We feel like we're trying to get all the oxygen in. But when we hyperventilate, we can actually make us feel even more panicky, and we make ourselves feel like we're losing breath, we're losing air. What happens when you hyperventilate is that the CO2, carbon dioxide level in your body goes down. And when that level goes down, you really can experience dizziness, you can experience palpitations. A lot of panic symptoms are actually related to not because we don't have enough oxygen, but because we don't have enough carbon dioxide, because we're breathing too rapidly. So breathe out very slowly, breathe in slowly, and don't breathe too fast. Breathe slowly and deliberately. For some people, it may be helpful to breathe into a paper bag so that you're recycling that air. For some people, it may be helpful to, close down one nostril, have your mouth closed, and just breathe through one nostril. These are all techniques to slow down the breathing so you don't hyperventilate and deplete your CO2. These are examples. There are many other DBT distress tolerance skills. If you're interested, you can go to a DBT site to learn more. There's a lot of free resources. My last slide will have links to some of these sites to look more closely at these strategies. One DBT technique that may be worth mentioning is a behavioral chain analysis. This may be helpful if you have kids that have problematic behaviors, but helpful for any of us really. It basically traces each step leading to a problem behavior that you want to avoid. So here's an example that I actually pulled from one of my clinic sessions where the problem behavior was smoking marijuana, smoking weed. And this girl, when she smokes weed, she knows that it makes her anxiety worse. It makes her feel really guilty. It makes her not very productive. So these are consequences. She really wants to avoid this behavior. So we were doing chain analysis because over Easter weekend, she ended up relapsing and smoking again. So we talked about what happened.
为的就是大麻是吧？
大麻，对， smoke weed, yeah. So she was saying, the behavior is that she smoked weed, and then we listed the behavior, and then we listed the consequences. And then I asked her, so what happened right before you smoked weed? She said, well, I went to hide in my room. Why did you hide in your room? Well, I went to hide in my room because I was feeling really, really overwhelmed. Why were you feeling overwhelmed? I was feeling overwhelmed because I was afraid and I was ashamed. Why? Because, it was a large family gathering. There were a lot of people there for the Easter weekend. I was afraid that they were going to judge me. I was afraid that they were going to ask me all kinds of questions. I'm not in school anymore. Are they going to think I'm stupid? I feel like a failure. So the prompting event was that there was a large family gathering. And then there were a bunch of links from this prompting event that led to the problem behavior of smoking weed. And then we start with vulnerability. What are some of the vulnerabilities that make you more likely to engage in this behavior? In her case, she has a history of addiction, so that already makes her more vulnerable. She also has a history of paranoia, so it makes her more likely to get anxious when she smokes weed. So this chain analysis, what it does is that it helps you see at what stage in the series of a sequence of events can you intervene. You can intervene at any one of these points, right? So if you see that hiding in your room makes it more likely that you'll smoke weed, then, you know, when you're feeling the overwhelm, find somebody that you trust, be with that person. Don't go into your room alone. If you know being in the room alone in a state of overwhelm makes you very likely to smoke weed. If you know that, you know, certain situations like large family gatherings or parties or whatever is likely to make you feel afraid and ashamed, then plan ahead. Either don't attend them. If you have to attend them, find a way to make an exit. Find a way to respond to people if you anticipate certain questions. Maybe think about, you know, am I engaging in thought distortions when people talk to me? Prepare ahead and prepare yourself against thought distortions. If I tend to be a mind reader and project certain things from people, then I will make a decision to not do that when I'm in this kind of situation, right? So when you analyze the sequence of events, you realize there are various points when you can break that chain so you can avoid that problem behavior. You can use this for any problem behaviors, whether it's substance abuse or overeating or self-injury. A lot of times people struggle because they feel like I'm out of control. I don't know why I do these things. There's no reason why I do these things. But when you make them do this chain analysis, they realize, oh, actually, I did this because of this, because of this. And so it gives them a sense of control also over all these events, because then you know why you're doing this. And then you can avoid certain stressors and you can plan ahead. So I think this is kind of a valuable tool that we can all use. And if you have children that have behaviors that you want to correct, maybe this is something you can do with them as well. I'm looking at the time. We're about at 1.5 hours. 我们差不多时间到了，对不对？我们想留一点 time for question and answer. The next couple slides that I have, I don't think I need to go over. These are kind of, these are other skills in DBT that are more change oriented and very kind of straightforward. And, you know, I can let people look at them, you know, in their own time. If you want to look at the presentation later, you can find all of these too if you Google DBT. So maybe I don't need to go over these things. What do you guys think? Maybe we can then see if people have questions.
王医生，非常谢谢您这么深入而且流畅的presentation， 真的很受益。我想请问一下，您有讲到过我们要 change thoughts， 对不对？如果说是一个医生让你等了一段时间，你会有不同的想法，会造成不同的情绪。那我们这是跟self doubt 有什么样的区别呢？就是说我们如果会 doubt 我们的 feeling， 然后 doubt 我们 feeling 的话，会让我们陷入一个一直在那种被 mistreated 的一种状态。我需要更清楚的解释一下吗？比如说那个医生可能
Can you give me an example？ 对，给我一个 example。
可能那个医生根本就是对你不重视，对吧？我曾经有一次，一个医生一直说马上就来，结果让我等了1个半小时。这种情况是不应该出现的。对。后来那个医院刚好他的有一个 open house， 就是让我去就是让 clients 去发表意见，我就把这说了。说了之后，我就再发现我这个医生对我的态度好了一些。其实前段时间不仅是让我等了1个半小时，而且别的实验的态度，就是说。就是进来看也不看我，就是 How are you？ 但是给我感觉根本就不 care How are you？ 但是后来等我反应之后的话，它有变化，知道吧？那在那种情况下是怎么样是改变 thoughts 呢？还是 follow your intuition？ 因为我们如果说是改变 thoughts， 像我是一个 people pleasing， 那我很多时候我都是在 doubt my feelings， 会 question 是不是我 make a big fuss of it。Right? Yeah. 是不是不太考虑别人的感受呢？那这种情况下，我会一直陷入一个真正是一个受害者被他 mistreated 的那种情况下。那这个时候是怎么样区别一个真的就是我们需要改变 thoughts， 还是需要 trust our intuition, respect our feelings？
This is a really, really excellent point, because that's kind of part of CBT that can be a little bit frustrating, because sometimes I hope you don't mind I'm using English. Sometimes our thoughts. Okay, so sometimes our thoughts and intuitions in this case are very accurate, right? Because indeed, in this case, the doctor was acting inappropriately, and you don't want to make yourself think, oh, it's my problem. I'm over analyzing and I'm overreacting. CBT isn't about making one thought more important than the other thought. It's about expanding the realm of possibilities. Now, in this case, we wouldn't say you're overreacting. There's all these other possibilities. Your possibility that the doctor is acting inappropriately is one of the many possible outcomes. And based on experience, that is the most, in this case, it's actually the most likely scenario, right? We talk about what are different scenarios, what's the most likely scenario, what's the best scenario, and what's the worst scenario. In this case, because of your past experience, right, that actually may be the most likely case scenario. So we say, the most likely case scenario is also in this case, the worst case scenario, unfortunately. So if it is the worst case scenario, what do we do, right? If we recognize that this doctor is kind of a sucky person, they don't respect us, how can we turn this into an effective problem-solving strategy? We can start to feel very angry. We can start to say, they're not valuing us. I feel really angry. I feel hurt. Those are all legitimate feelings. And part of CBT is it kind of always wants us to kind of change our thoughts. That's why I feel like it's also important to bring in DBT, because our feelings are valid in that moment. Based on your experience, that's probably what's happening. That doctor is not very conscientious of time management. So your thoughts and feelings are valid. But then we kind of move into kind of problem-solving standpoint. Let's say the worst case scenario is that he does not really respect my time. So what do? I have choices. I can go and make a complaint like you did. I can go and try to change the outcome. I can choose a different doctor, right? So we don't dwell on this, I feel valued, I feel worthless, I feel angry. It's okay to have those feelings, but we always also move on to problem solving. Even in the worst case scenario, this is a terrible doctor, is a doctor who doesn't respect people's time and space. In that case, I can still be okay. I don't have to stick to this doctor. Maybe I have some agency in change. Maybe this doctor is ineffective, not because he doesn't respect, but because he's not very good at managing time. Sometimes I run into that problem, not because I don't respect people's time, but I'm also a people pleaser. If somebody's really needing me, I kind of, go overboard, and I may extend that time, and then I run into other people's time. So maybe it's their ineffectiveness. Maybe if I complain, maybe if I say something, maybe it'll help them. So again, I don't want your feelings to be invalidated. If you know this is the most likely case scenario, trust that. If you know that that's what's happening, that's okay. But even in that scenario, even in the worst case scenario, that doesn't have to destroy your day. You move out of that kind of reactive, angry phase and go, if that's the case, it doesn't have to ruin me. It doesn't have to ruin my healthcare. I will do something about it. I will complain. I will talk to management, or I'll go find a different doctor. Does that make sense?
Yeah, very well. 谢谢你。那我在想，就是说，我们要经历，因为我就是很容易 self doubt 我的 feeling 嘛，那总觉得一次可能不算，对吧？我虽然 my gut feeling 是这个医生可能不一定很合适，但是 I try next time，try next time，try next time，是一直到等到最后爆得不行的时候，I'm down。但是就是我们要 trust 怎么样？要试几次呢？有人就是中国有句话就事不过三，对吧？那我们要试几次才会觉得 ，Yeah, my gut feeling is right。而且不是说一开始就 make big fuss of it，但是呢，也不是说是一直让自己 tolerate the situation 一直到爆。
Right, exactly。
就是要到一个什么的程度。
So I think we start with, you're talking about two extremes. 一个就是一直忍耐，一个就是爆发，对不对？ In between that, maybe there's room to kind of have open dialogue, to maybe bring this up to the doctor in a friendly but serious way. And that's actually, the interpersonal effective piece of DBT. How do we advocate for ourselves so that we don't wait until we are explosive? How do we engage in a conversation so that we know that we have some needs that are unmet, maybe before you get to the explosive stage, before you get there, You can say, maybe I'm wrong, maybe I'm right. Let me find out. Let me communicate. Let me talk to this doctor. See if I can open up that channel of communication. Then I will have more evidence to say, are they really just dismissive of me as a person? Are they really disrespectful? Or maybe is there room for them to understand where I'm coming from? Right? So we don't have to either repress or explode. The idea is that we find ways to kind of find evidence either way and kind of keep that communication channel open. But I think a bigger issue that you're saying here is that you have a tendency to doubt yourself and you have a tendency to not say what's on your mind because you don't want to offend the other people and you don't want to make a big deal out of things. That's a deeper issue. And I think that that's where maybe we need to engage in a bit more of a psychodynamic kind of understanding why you form this tendency, what your experiences as a child, you know, what kind of experiences. Right. Like we need to maybe do a bit more digging in that area. And then if you realize, okay, these experiences, these dynamics make me always doubt myself. Maybe I've had really invalidating parents or, I'm not saying that's the case, but maybe then you have that insight. You have that insight. Then it becomes a skills thing. So every day you need to practice. Okay, I realize I'm doubting myself. So I need to choose to have some faith in what I'm thinking. And I need to realize I can advocate myself without destroying the other person. I can advocate myself without making the other person feel completely angry. And the way you do that is by practice. You know, you make it a point to always speak up and finding ways to communicate in a way that, you know, is not until you're explosive. And that, you know, that just takes practice.
太棒了，谢谢王医生。
Thank you for sharing.
Oh, thank you so much.
王医生，我想替那个chatting room 里的朋友们问一个问题，这个问题被 repeated 的问，就是青少年的这个网瘾和拖延症，他们的背后有什么心理的原因吗？就是 generally 可以说一下，我知道你的时间快 run out 了。
I can. It's a good topic. It's I can talk about it in generality. So addiction, online addiction, and procrastination, right? So there could be various things underlying these behaviors, and it really depends on the individual. But what I see a lot of times is avoidance and escapism. So in my patients, a lot of times they procrastinate because they're unable to face the challenges that delving into something would present. They're afraid of failure. Maybe they're a perfectionist. They're afraid if I do it, it's not going to be good enough. So instead of delving into it, I'm just going to avoid it. I'm just going to pretend it's not there. I'm just going to wait and wait and wait until it becomes really, really impossible to engage. And then you procrastinate even more. With online addiction, similarly, I mean, it's not always about avoidance because, you know, it depends on what they're using online activities for. It may be that that's their way of getting social interactions. Maybe in real life, they have difficulty communicating with people, but in, you know, an online forum, it helps them open up. So there may be other things involved. But a lot of times I also do see that people scroll social media because that's their way of avoiding the pain of what's going on in their present. Like if somebody has a big presentation that they have to do, if they have a difficult kind of interview that's coming up, if they think about it, it makes them anxious. So they distract themselves. And social media is so pervasive. It's so easy to just scroll through and before you realize that a lot of time has gone by and then you're even further behind. So, you know, that oftentimes is an avoidance strategy as well. But sometimes because you do something so much, especially with some online games, there may be a real element of addiction, you know, because your dopamine system is all kind of whacked up at this point. So it may also become in itself kind of an addictive process apart from avoidance and all of that. So it's complicated. And I think the starting point is having a conversation with a child to understand what purpose is this serving? Are they using this to distract themselves from some sort of emotional pain? Are they using this because this is the only way that they can feel connected to somebody? Is there a real element of addiction? So these are all questions that we have to start asking.
谢谢王医生。你觉得网瘾会 trigger depression 吗？他们会 feed each other 吗？
Yes, I think so. Yes. Yes. Depression can cause people to be more susceptible to addiction, not just like internet addiction, other types of addiction as well, and vice versa. But sometimes we call things addiction when it's really not addiction. This is, I'll use this example. So some people watch porn and kids watch, some kids, it's okay that people have natural kind of needs and they may watch porn and they may feel very guilty about it. And because of that guilt, they think that anytime they do it, it's an addiction, or they can, they can't stop thinking about it because they live in an environment where people don't talk about sex openly. So they have to do it in secret. And then they're thinking about the next time they can watch something, and they, people may perceive that as addiction when it's actually not addiction. So we have to first understand, is it really addictive? Are they really addicted?
谢谢王医生。
我看到有3个举手的，不过有一个问题我先问一下，就是有的朋友问说，对高功能自闭 Asperger 的孩子 CBT DBT 有用吗？
So this is an area where I think part of it depends on how high functioning this child is, how much they're able to engage in this kind of therapy. So, high functioning also has a range. And this is an area where, admittedly, I don't have enough training. I feel like, this is where maybe as a developmental psychologist, they actually would have more training and more expertise in specifically working and doing therapy with, people on the autism spectrum. So I have some patients that I work with that are very, very high, extremely high functioning, like, professor level, or, doctors who are actually on the spectrum. And for them, CBT works just fine, but they're extremely high functioning. They're able to compensate, they're able to engage, but not all high functioning are at that level. So it depends on the individual. But I think this is also a case where I might actually refer the patient out to somebody that have more training than I do with regard to autism.
下一个举手的是，
我想问一下，就是那个网瘾的问题吧，就是说刚才讨论到这个网瘾引起抑郁症，但是呢，我也是看了一些书吧，就是这个网瘾呢，其实就对有抑郁症的孩子，就是特别是对那个大学生的话，有很大的压力，特别是在 Covey score 的或者 Medical score 的学生的话，实际上我觉得那个游戏可能也是帮助他们，就是说 reduce 那个
yes，
就是说
it may be a coping mechanism. You're right. Yes.
对，所以就是说现在就是说，我觉得就是 force 他那个完全戒掉网瘾的话，是不是一个 rejection 的话，就对孩子的话更大的压力，因为抑郁最害怕 rejection。
That's a very good point. Even though I think any sort of addiction can worsen depression, the way we treat addiction also is not abrupt discontinuation. Whether it's internet addiction or addiction to alcohol or addiction to opioids, we don't abruptly stop it because that can be extremely difficult to tolerate. There's a process of gradual taper, right? And also to your point, because it serves a purpose, it's their coping mechanism. So on the one hand, we don't want them to be addicted. We want them to fully participate. On the other hand, we also want to replace, if we're taking that away, we have to find something else that we can replace that with. So we can't just focus on forcing them to stop this behavior. We need to think about, what is this behavior serving? It's serving a purpose. So can we find something else to replace it? And as we gradually cut down, we have to recognize it needs to be also a gradual process. It's not just from up here to all of a sudden nothing, because that can be very, very difficult as well. And it can cause more emotional dysregulation.
还有一个第二个问题就是我自己吧，实际上我小时候就是很自闭的一个人，就是说，然后就引起自闭呢，就跟人交往就引起这个特别的自卑，就是 low self esteem。所以呢，就是说，然后呢，我觉得成人之后呢，就有一些事情呢，就是我觉得也是个抑郁引起，就是说犯了一些错误。现在呢，就是我们这个州呢，全都是 white，over 那个90% 是 white people， 就是很大的那个就是那个 discrimination， 就是在 work 里 discrimination 很厉害，所以呢，而且就是说，而且也很难找到一个说中文的医生，所以我就想自己帮助自己的话，最好的方法是看哪一些书，或者是看哪些心理的医书，或者是怎么样的话。
Yes, yeah. So once I publish the slides on the last page, there will be quite a few resources. There's a lot of podcasts, even for CBT and DBT, there are different types of podcasts. I listed them there. There are you can, if you're interested in DBT, right? There's a book called DBT for Dummies, and it's written actually by one of my McLean supervisors who is really an expert in DBT, called DBT for Dummies. That may be a very good book if you just want to kind of really delve into methods of DBT. Another book that I actually think it's not really psychological. It's not, written by a mental health expert, but 7 Habits of Highly Successful People is written by Stephen Covey. It's very accessible, and it takes you through kind of a value system that helps you approach life in a more holistic way. I feel like for people that don't necessarily just want to think about, psychological kind of disorders, but you want to think about how to establish wellness, how to live meaningfully and fulfilled. 7 Habits may be a very good book as well. But I'm going to make a list of resources available on my last slide, and you can go take a look at that at the end of the presentation.
好，谢谢你啊，好。
王医生你好，因为chat里我看有很多人问问题啊，我觉得有一个问题可能对很多人都有共性，就是说他说有这个孩子已经大了。上大学了或者工作了，然后他发现他自己有这个精神心理方面的需要，他也去找这个help 了，就 therapy 了。那么家长呢也想要跟他搞好关系，帮助他，但是他就不理家长，那家长就很苦恼，他就问他说：“那我现在应该是继续 try to reach out to the child 呢，还是说我就应该？”就是尊重这个 boundary， 他不愿意理我，我就不要去理他了。因为孩子说的是家长想要控制孩子，但是家长实际上想关心孩子。对，我觉得因为您也是一个就是说在我们2代人中间，又是这个行业，可能对这一点要有这个insight 的这个 points。
That's a really good question and a very common situation actually I see in clinic. So do we leave them alone or do we continue to try to reach out? I think this is where dialectics come in. We do both, okay? So I don't think we should completely just leave them alone, but we should respect boundaries. A lot of times when kids say, I don't want to talk to you anymore, they don't mean I don't want you in my life. They mean I want you to respect my boundaries. If you talk to me, you have to talk to me in a way that I can accept. A lot of times parents talk in a way that is indeed controlling, maybe not this particular instance, but maybe there's a history of them talking to kids in a way that's controlling, that makes the kid actually feel a little bit traumatized. And whether or not the parent has that intention, there's that history there. So it's hard to kind of break through that. How do you break through that? You have to prove to the child that you can respect their boundaries. So ask them what is okay, what is not okay. If the child says completely be out of my life, well, I can't do that. You're my child. I love you. I want to stay in your life, but I don't want to control your life. I just want to be a part of it. Find ways that they can accept and respect their boundaries at the time. You don't just leave them alone, but also you do need to respect their boundaries. Now, if you worry about safety, if they're about to commit suicide, if there are these concerns, then yes, you have to breach that boundary. But short of that, if they want you to not keep asking questions, for now, you say, okay, I'm going to listen to you. I'm going to respect that. I won't ask those questions, but maybe we can talk about something else. Maybe we can take a walk together. There are different ways to connect.
好，谢谢。
谢谢我。
那我再问下一个吧，我觉得也是chat里头的这个问题，我觉得也比较 general， 就是如果你身边的人，你觉得他确实是有狂躁啊，或者是抑郁啊，或者是怎么样，你觉得他很需要看医生，但是他自己就不承认，然后他就不愿意去看医生，你怎么样能够帮助他，让他认识到这一点？
It's very challenging. Ultimately, it comes down to your connection. 你和这个人之间的 connection. Do they have that trust in you? 如果比方说他真的是到有躁狂到一定的severity， 那这个时候他是没有 insight， 不管你怎么说也没有用，真正的。When they get to that point of, real mania, 那你说什么也没有用. So there may not be very much that you can do. But if they're acting in an unsafe way, 如果他们的躁狂导致他们做出一些就是过火的行为，让他们有安全方面的问题的话，那这个时候不管他愿意不愿意，你都可以叫救护车来，你都可以拉他去医院。他可能会很憎恨你 ，but that's the right thing to do. 不管是躁狂还是 depression， 如果说这个人有人身安全了，那不管他愿意不愿意，你要把他送去医院，你要打电话给911或者给医院。But if they're not at that level and they really, really refuse, there's honestly, there's nothing you can do. Like there's nothing I can do either. If somebody comes to me, but they refuse to do anything, you know, even if they're in my office, I can't force them to do anything. So people have to be willing to accept help. Now there's a little bit of room where if they are very connected, if they really trust you, and if you're not too pushy, maybe you can establish that connection. And then over time, very gradually, you can help to increase their awareness. You can show that you care. You can be with them. You can hear them. And then maybe over time, they will be more willing to listen to you. But sometimes there's nothing we can do, and we can't take it all upon ourselves either.
谢谢王医生啊，这里还有一个问题就是有人在问有没有emotional 和 physical abuse supporting group for Asian women 在Eastern United States?
I have to look into that. I am not. I mean, these kinds of support groups exist a lot, but I don't specifically for Asian women. I'm not sure. I can talk to my colleagues at Mass General where they do a lot of cross-cultural work and see. I'm not aware of any specific just Asian women support groups. Maybe
对，我知道有那种 abuse 的for women for generally women 的 shelter 是吧？但是没有说。对
specific ethnicity 这个好像我不知道 but I mean I can look into it. I can ask.
也许去那个 shelter 他可以找到那个 translator. I'm not sure. 对
Yeah.
另外一个 question 就是对这种 teenager 在青少年的时候，你觉得是因为荷尔蒙的缘故，他们会 act 对父母比较 rude 和disrespectful 吗？还是这是正常的吗？
Yes and yes. I mean, because of hormones, they may act, you know, like they may act like they're pathological. They're very impulsive. They can get angry easily. They can be agitated. It's hormones and it's to be expected. It's also developmental.
So where is the boundary? 父母应该说，这个是 cross the boundary. You have to be disciplined, or we should understand and 知道这是一个 very difficult stage for them.
I mean, I think that depends on open communication. I mean, there's some boundaries. It depends on the family, but there's some boundaries that you cannot cross, right? You can't punch. You can't get physical. My kids are still young, but still have these boundaries. You can't, you know, sometimes they can't help themselves, but still that's a boundary. You can't punch. You can't hurt somebody physically. You can't intentionally hurt somebody. You can lose your temper. You can yell, but you need to somehow come back and have another dialogue about it afterwards. You know, I think this comes down to family value. This comes down to what's acceptable to your particular family. But I think if there's any safety issues involved, then that's a clear boundary.
还有很多人想知道怎么联系你，你收不收这个 medical insurance？
Yeah, so I apologize. I don't take medical insurance. My clinic is actually full at this point. So like I said, you know, there's a wait list, and you can go to my website, buckspsychiatry.org. But like I said, right now I'm full. I do have a wait list, and if you're able to wait a couple months, you know, I may be able to see you, but it's not right now.
谢谢王医生。下面 Alan 要问一个问题。
对王医生，谢谢哈。我想问一个问题，就是比方说对于这些高中生孩子的这些家长嘛，就是以前他们也发现他会有一些问题，但是呢，一直孩子也不同意去见医生见 therapist 那些。那是如果真的发生了一些什么情况，什么情况下其实可以请这个介入，就是说，就给他把他送到 emergency， 这样的话呢，他就被迫就要去看医生了。这样就会有一些资源给他，是什么样的情况可以做呢？
Good question. So for especially for high school students, right? So if there is any kind of suicidal ideation, if you discover that they're making threats that I don't want to live, you know, I'm going to hurt myself, I'm going to hurt somebody else. If they're making safety threats against themselves or against somebody else, you document it. You call and you get them into care, whether or not they want to go. So safety is one big thing. The other big thing is if they constantly miss school, if because of their mental health issues, they are, you know, there's a lot of truancy, they're not able to go to school, their grades are completely falling apart. At that point, even if you don't, the school system may actually get them into care because that's another sign that they're not doing well. Let's see what else. If they're not taking care, like if they're not eating, if they're not taking care of personal hygiene, you know, sometimes kids can be sloppy, but if there's a huge change from baseline in terms of how they operate day to day, you know, if they're losing weight, not eating, if they're not showering for a week at a time, if they're never leaving their room, they're just isolated in their rooms, these are all symptoms that you can actually say, well, that's severe enough that an intervention needs to be made.
哦，谢谢王医生。那还有一个就是我想问一下，就是什么样的情况就是去到医院之后，他们会给他转接到精神病院？
如果这些症状是 because of psychiatric issues， 你说转到精神病院，就是说如果他先去一个 general hospital， 然后把他转到一个 psychiatric hospital， 是这个原因吗？
对，
okay.
因为我是做翻译的，有时候工作之中的话，我会遇到这样的情况，我就看到有些孩子呢，他们是被送到精神病院，然后在那里待了一段时间，最后是需要医生同意他才可以出院的，平时只能是妈妈过来看他，或者1-2个小时带他回家那样子的。
对，就什么情况下他如果去了一般的 general hospital， 然后会被转 admit 到 psychiatric hospital， 那 it depends on the reasons that the child is brought into the hospital, right? So if the child is brought into the hospital because they're refusing to go to school, and in the process of interviewing whoever the doctor is in the hospital, when they interview the child in the emergency room, if they have any concern that the child is really depressed and these symptoms are a result of depression or anxiety or any other psychiatric illness, then they will send the kid to a psychiatric hospital. It depends on what the reason is for them to go to the emergency room in the first place. A lot of times kids may be brought in because, they have erratic behavior, or maybe they're not eating, they're worried about dehydration. But once they're in the hospital, they realize the root cause for these things is actually because they're very depressed or because they're psychotic, then they get sent to the psychiatric hospital instead. Sometimes to get into a psychiatric hospital, you have to go through the emergency room to have medical clearance to make sure that there's no other medical reasons that the kid is behaving this way. So you may still have to go and get, all these physical workups done, which is a good thing, and then go to the psychiatric hospital.
好的，谢谢医生。
Thank you， 王医生。就是刚才您讲座的时候，您提到有很多人他会使用 life coach， 不管是 parenting coaching 还是自己的 life coach。那我们找这样的人的话，这些人需要 certificate 吗？还是他们就可以自己 self claim as a life coach？
This is a hard one because I'm not familiar with exactly how certification of this coaching thing is done, and it's very vague. It's kind of vague for me. 我觉得如果你要找 coach 的话, I think you should look for somebody with certification. Now, I'm not familiar with that whole process, but some people may claim to be a coach and they may not have had the right training. So just as if you look for a doctor, you want to make sure that they actually have a medical license. I think you should look for somebody with real credentials.
Okay,
但是具体怎么样子 confirm, I'm honestly not too sure about coaches.
Okay, thank you. 我就是觉得其实这个话题我知道，就像很多人，你看咱们现在在身体方面的管理，就是说如果哪怕身体感觉很健康，也会每年去做年检啊，也会去找一个健身教练，就是为了更健康嘛。但其实精神方面，我觉得是更需要的。哪怕你觉得我是个正常人，也是要找 coach， 就是要更健康，心理健康更健康的那种，
更上一层楼。
对，就是其实跟照顾身体是一样的，我觉得。
That's a very good point. That's a very good point. Whether that's through a coach or a support group, sometimes even just having a group of friends that you periodically check in with each other. 如果其他方面你 everything is very good, even sometimes just having that like meeting with friends periodically may actually be a way to check in as well.
Okay, thank you, 王医生。
其实还有几个举手的，然后那个 chat 里面其实还有不少问题，不过王医生那边可能他家里有孩子，有时超时了挺长时间了。
Maybe what I can do， 如果就是这个 chat room 里面还有一些问题的话 ，maybe I can type, if we can do like record these questions, I can maybe answer these questions in my own time, and then if there's a place where I can.
我们放到微信